Good afternoon and welcome to Glaucoma Australia's live webinar. My name is Sapna and I'm a patient educator at Glaucoma Australia. Our special guests for today are from Guide Dogs South Australia and the Northern Territory. A big thank you and welcome to Jason Law and Prue Kalisch. Prue is a senior orientation and mobility specialist and Jason is a senior orthoptist and a clinical services team leader at Guide Dogs. Some of you listening may have spoken to Jason in the past, as Jason was also a clinical volunteer with Glaucoma Australia and has helped us provide support to many of those who are living with glaucoma. In this session, Prue and Jason will discuss a range of low vision services you can access through Guide Dogs South Australia and the Northern Territory. Please feel free to send through any questions you have. We will be going through them at the end of Jason and Prue's presentation. In case we don't get to answer them now, please email them to glaucoma@glaucoma.org.au. Okay, over to you, Jason and Prue.
Thanks, Sapna. Thanks for having Prue and I. It's a pleasure to be here and pleasure to take the time out to discuss, vision services within Guide Dogs SANT, and from a greater organisation, Guide Dogs Australia. So Prue and I will be speaking about, vision services and low vision services that clients that are on offer for low vision and potentially glaucoma clients as well. Prue, did you have anything else to add before we get started?
No, happy to start.
So vision service from Guide Dogs SANT. Not many people do know that Guide Dogs, as an organisation, do offer additional services. As not everybody or everyone with low vision, will need a guide dog. So I'm here today to go through our different vision services options and what guide dogs can potentially offer a client. So Guide Dogs SANT, we offer a number of vision services within our organisation. Majority of our services offered through occupational therapy, orientation mobility, orthoptics, and our consumer liaison services. So within our team, we have OTs, O&Ms, orthoptists, myself, and consumer liaison officers. So occupational therapy is a client-centered health profession that involves assessments and understanding to what activities and any visual limitations hindering these goals and motivations. Orientation mobility. Prue, did you want to quickly explain what orientation mobility is?
So my job is to help people who have low vision to be able to travel safely and independently through their local communities.
Good. And orthoptics. I myself am an orthoptist. We play a role in the detection, diagnosis and management of eye diseases in both adults and paediatrics. We're traditionally involved in the management of patients with eye movement disorders and specific, double vision, as well as neurological disorders. And our consumer liaison officers within Guide Dogs, they help assist clients who have difficulty gaining funding, who need extra assistance, and they also lead our social and educational groups. So we have educational groups called Social Happy Hour, Empowered Living Program, and school holiday camps as well. So these are all services that we Guide Dogs SANT offer: low vision assessments, neurological vision assessments, functional capacity assessments, falls prevention, cane training with orientation mobility instructors, assistive technology, and social and educational groups. Why is vision important? Most of our knowledge of the outside world is obtained through vision. 80 and 85% of our learning is based upon our visual pathway, and it allows us to form an understanding of space, 3D space, and it allows us to help move safely and to avoid danger. It also enables us to see facial expressions, emotions, gestures, and body language. Here at Guide Dogs SANT, we often come across clients or patients who suffer from glaucoma, age-related macular degeneration, cataracts, diabetes, congenital vision loss, and also brain injury. We service all ages, starting from early childhood, which is 0 to 9 years old, school age 9 to 18, and adults 18 plus. Definitions of visual impairment. Vision impairment is defined as a reduction in vision which cannot be corrected with use of glasses, contact lenses, surgery, or by any pharmaceutical means. Vision impairment encompasses low vision and blindness. So we often come across clients who have low vision or blindness. What is legal blindness? So the Australian government defines legal blindness as visual acuity, so measured on a chart of 660 in both eyes after correction, or a visual field constriction to within 10 degrees centrally. And that was defined by the Department of Health back in 2005, and that still stands today. Just for illustration purposes, on the left we have nice, clear, precise image, normal vision, 6.6, and on the right we have what's defined as legal blindness, which is 660. And that picture is a blurred picture, not clear, and not as precise. Some common causes of vision impairments that we as an organisation come across. Glaucoma is quite prevalent in a few of our patients, and we often see the end stage of glaucoma. So glaucoma is the damage to the optic nerve and causes peripheral vision loss, and is often referred to as a silent thief of sight. Macular degeneration is a very common pathology that we come across, and that impacts our central vision, our fine detailed vision. And in this illustration, we see that the centre of that picture is missing, and this is a common symptom of macular degeneration. Cataracts, they are a clouding of our natural crystalline lens. Symptoms with clients who have cataracts are hazing of vision, blurring of vision, just that overall cloudiness, also sensitive to light and halos around light. Neurological vision loss. So here at Guide Dogs SANT, we service lots of clients who do suffer from neurological vision loss, and this picture depicts vision loss that quite a lot of clients experience post stroke, post neurological insult. So in this picture, we have a picture of, I think, a city, and the entire left-hand side is missing from that vision. I think with our services here at Guide Dogs SANT, we like to look at vision loss and how it impacts someone's function and how it impacts their day-to-day living. So some impacts of vision loss include inability to drive, difficulty reading, social interactions, which then lead to increased isolation and reduced quality of life. Clients are also at have greater risk of falls and increase their reliance on support services and others around them. I'm going to hand over to Prue, our Senior Orientation Mobility Instructor, who will now talk about orientation mobility. Thanks, Prue.
Okay. Thanks, Jason. So what I talked about before, what my job is helping people to be able to get out safely and independently. A lot of clients, especially if they've got glaucoma, might feel hesitant going out. They're worried about a trip or a fall. And we want to make sure that they can get out and feel confident in where they want to go. So the orientation is making sure that they know how to get from home to the shops or wherever their destination is, and doing that efficiently and with the best route. And mobility is making sure that they have the safe skills to be able to complete that route. So part of what we do is an orientation mobility program. It could be a variety of things. So some of our clients might need a cane. You don't have to be totally blind to use a cane. You can have low vision. What the cane will do is it has two main benefits, I guess, for our clients. The first one is it lets other people know that this person has a vision impairment. So I always talk about if you saw someone with a wheelchair or a walking frame or a long cane, people will move out of your way, so it gives you a clear path. So it helps with that identification. The cane's also going to help by picking up any obstacles or hazards. So I don't know about other places around Australia, but Adelaide doesn't always have the best footpaths, so there's a lot of tripping hazards. So the cane's going to take care of that. We have a lot of clients that tend to look down at their feet because they're worried about tripping over. So a cane's going to give them that bit more confidence walking. It means that they can actually walk more stable. They can have a better upright position. The low vision training might be that they don't want to have a cane, but we can show them a few things of how to identify where there are tripping hazards or how to be safe. We use electronic travel aids. So these are things like you might be using your phone to use Google Maps. It might be learning how to use something called a mini guide. The mini guide is almost like the reversing sensor on the back of a car. So it's going to vibrate, let you know that there's an obstacle coming. And then if our clients really want to go into a guide dog mobility, that's another thing that they can look at. They do need to do their cane training first, and there's a couple of reasons behind that. One is we want to know that they're a really good traveller before they go to a guide dog. But there are days where guide dogs can't work, and it might be it's over 35 degrees, too hot for the dogs to go out. The client still wants to go out, so they need to be able to go back to their cane. And then the last thing we do is orientation. So it might be that they're really good in a familiar area that they, I always go to visit my daughter and I know how to get there. But now I'm going to go visit a friend and I've never been to their place before, so I might need a bit of training with that orientation. So on the next slide, this shows the mobility aids that we commonly use. The first one on the left-hand side is a support cane. So this is a white walking stick. The idea of it is that it's still used like a walking stick, but being white, it just identifies that this person has a vision impairment. Next across is the mini guide. So this is what I was talking about. That's almost like that reversing indicator. It's a handheld device. A lot of clients really like using it because it means that the cane will take care of what's at the ground level, but the mini guide's going to find obstacles such as trees or other people, things like that. It also shows a couple of canes. There are two different canes that are on here. One of them is the long cane. This is the one that you see people have on the ground and it's feeling the ground in front of them. The other cane is an ID cane. So this one, people don't necessarily touch on the ground, but they just have to let other people know that I don't see so well. And then, of course, the final aid is the guide dog. One thing we train people in is something called human guide. I've been working guide dogs for over 20 years now. When I started, it was known as sighted guide. And the reason that this has changed is anyone can actually be a guide. We've got clients who are totally blind, might use a guide dog, and they can still guide people. So the name is now human guide. The idea of human guide is it's a way that I can assist a client to travel safely, efficiently, and with dignity through the environment. So they're holding onto my arm, I'm guiding them through. It might be that they're having a bit of difficulty with their vision that day. With the different vision impairments, sometimes people might see better in dark or light, or they might have a vision impairment that's quite variable. They might be going somewhere unfamiliar and they just go, look, I would like just a little bit of help to be able to get through that environment. So we train our client how to use human guide. We might also train their family, their carers, their support people so that they can travel independently. So when it comes to referrals, we don't actually have a minimum number. So, you talk about legally blind or low vision, things like that. If a person has a vision impairment that's affecting their safety and independence, then they're relevant for a referral. We can get referrals from the clients themselves. It could be from a health professional, a carer, a family member, or a friend. So we're welcoming referrals from anyone. Easiest way to refer, you can either call up on 1800 757 738. You can visit Guide Dogs on our website, or you can email, which is support@guidedogs.org.au.
Thanks, Jason. Thanks, Prue. So we do have some questions, which hopefully you can answer. First one is, so what is the formal process involved for a person with glaucoma, in these terms, to become a client for guide dogs? Do they need a GP involved, optometrist, ophthalmologist? But where do they start from?
If a client has glaucoma and would like to get involved with guide dogs SANT, I would suggest, they get into contact with our client support team or give us a call. And then we can work through what their needs are, what their goals are. The more information that's provided, the better. So they don't need to have, GP referral or optometrist referral. They can, send through an email or give us a call.
Okay. And do they have to turn up to one of the offices? Because what we've heard of things such as assessments work, like in-home assessment. We always hear that term. And I'm guessing that's for people who can't travel out, or like in regional South Australia, in Northern Territory. Does Guide Dogs provide that? And how do you assess somebody being suitable for that?
We do assess that. Our services currently, majority of our services are within the home and within the client's, residence. And we do also have a clinic that clients can attend as well. So it depends on clients' mobility, their support levels, if they can, get a lift. And we take all those things into consideration. So majority of our visits are within the residence.
Okay. Now, can you explain to us why Guide Dogs has different offices? Like, you guys are South Australia and Northern Territory. Is there any difference between, so those listening in from New South Wales, Victoria, Queensland, Tasmania?
So Guide Dogs, we service SANT, and Guide Dogs Victoria serves Victoria, and Queensland as well. So, and New South Wales. Our services may differ slightly, but all guide dogs do offer orientation mobility services and occupational therapy services.
Okay, that's good. Now, what happens if a person with glaucoma, they feel that they need a low vision service, but the ophthalmologist or the optometrist don't agree? What's the best advice for this person? Should they still contact Guide Dogs and see, if they'll benefit from the services?
Absolutely. We say get into contact with us, talk to someone from our client support team and work out how we can best support them. At the end of the day, we're looking at functional vision. So how their vision impacts their day-to-day living, their ability to mobilise, in the community around the home. So if they have, questions and they're struggling a little bit, with function, we can definitely help.
Now, is there any cost involved in guide dog services? And then does Medicare play a part in it, private health insurance, other concessions?
Yep. Prue, do you want to quickly go over the funding options?
So there's a few different funding options. If they have NDIS, we'll charge through NDIS, or if they have My Aged Care, there might be a co-contribution. We do have a charity funding, so clients that don't have any funding themselves, we can provide a service for them at no charge to the client.
Okay, thank you. Now at Glaucoma Australia, Jason, you've done some work with us. Our mission is to save vision loss from glaucoma, but unfortunately there are cases that do lead to vision loss. So is there such thing as accessing low vision services too early? And can a person with glaucoma start reaching out services before being declared legally blind, or before being told by their healthcare practitioner that, they are losing vision? And what are the signs that they should be looking for so that they can act on, getting help sooner than later to avoid falls and injuries and lacking motivation?
I think working with Glaucoma Australia and, guide dogs has really opened my eyes into, patient or client education. The more we can educate the clients about glaucoma, the better, and the symptoms related to glaucoma. There's no restriction on accessing low vision services too early. If a client is experiencing troubles around their home and day-to-day living, that's definitely a question they can ask our client support team, and also their healthcare practitioner, their optometrist, their GP.
Sorry. I was going to say, we also sometimes have clients that have additional diagnoses such as Alzheimer's or dementia. And so clients want to learn strategies now while they can still learn the strategies. So sometimes for us, getting in early intervention is much better than leaving it to a point where they might not be able to pick up the skills as easily.
Definitely, yeah. And then, so in saying that, do you ever have clients who refuse to use vision aids like canes or even wear badges? That's often we speak to people who they refuse to do that. They're embarrassed, or they don't want to look helpless by letting people know that they have low vision. And what advice would you have for carers or family members who know that they're supporting somebody who will benefit from reaching out to an organization like Guide Dogs, but they're refusing to do it? Like, how would they encourage them, and how can you help them get into the right mindset to actually accept that kind of help?
I think our social groups do really good with this, because the clients get to meet other clients that are going through the same thing, and hearing it from someone else that actually says, yes, it actually has helped me. We also, from my point of view with the canes, is they might pick and choose when they use a cane. So we go, you might not have to use a cane at your home, but it might be when it's dark, or if you're somewhere unfamiliar, that's when you use a cane. So we can help them pick and choose when it's appropriate to use the aids.
Sounds good. I think that's all the questions we have for today. Jason or Prue, I'll just get you to quickly remind us of how to contact Guide Dogs. So there's email or a phone number for South Australia and Northern Territory. And to our viewers out there, you're welcome to email through all the questions you have afterwards as well.
Yes, we do have an email and phone number. If we're able to get up our slides again. So
the phone number is 1800 757 738. Email is support@guidedogs.org.au, and then our website is sant.guidedogs.com.au/request-a-service.
Thanks, Prue.
Thank you, Jason, and thank you, Prue. So once again, thank you for all the information you've shared with us today, and we'll see you next time.
Thank you.
Thanks for having us, Sapna.
No worries.